The straightforward question is it time? Like all day today, relock Delhi has been trending. Is it time to seriously consider relocking Mumbai till the time Mumbai is unlock ready? We are asking a straightforward question. Is Mumbai losing the plot in this COVID fight? It cannot be a hand-to-mouth and day-to-day kind of an existence ki aaj nikal gaya, kal kaise nikalenge, dekhenge. We can't do that. Let's go across to our guest straight away, set up the debate. Rajiv Pandey, spokesperson of the BJP with us. Sanjay Jha, spokesperson of the Congress party. And of course, somebody who's fought hard against COVID and recovered well. Dr. Rajesh Parekh of the Jaslok Hospital. He's the Director of Medical Research. And Akashdeep, filmmaker. My submission is very simple. When we knew that Mumbai with a base of 2 crore population, plus or minus a few lakhs here and there, I'm just saying, let's say 2 crore population, with an average of 20,000 people per square kilometer density of population. My question, Akashdeep, before I bring in the political voices in Sanjay Jha and Rajiv Pandey, and my line of questioning is, was there enough thought before they said, chalo kholte hai Mumbai ko, chalo let us unlock? Where suggestions are coming कि suburban train को खोलते नहीं तो लोग काम पे कैसे आएंगे? But my point is, sir, if you are going to look at that, are you ready for the spike in cases? Are you ready with at least 2 lakh beds?
No, I really think, Anand, that there has been no consensus and a combined sitting of brains to take this call, because the videos that I see after there's been a slight relaxation in the lockdown, the way people are crowding into buses, the way people are now seen all over, I just don't understand why were we put through 2 months of lockdown when cases were just about 100, 200 all over the country, and now with 10,000 and Bombay, I mean, leading the way, nobody is bothered. It's as if people have just put their hands up and said, yeah, we give up. I thought the idea of the 2 months of lockdown was for the medical system to gear up, to get its act in order. What has happened after 2 months? We are finding cases are going haywire. There is nothing happening. People are dying, searching for beds. The other day, there was a body found somewhere 14 days after a man was missing from a COVID hospital. He was discovered in the toilet. That means nobody even went to clean the loos. I mean, what are we doing? What are we doing? I don't understand on what grounds can even Bombay and Maharashtra think of opening up. We are just not prepared. The numbers are there to see. I mean, I understand that the economy needs to work, but then the whole country very, very diligently obeyed the PM's orders for a lockdown for 2 months. That was enough time, but nothing seems to have worked. With 1,000 cases in Bombay every day, let's presume just 100 or 200 need hospitals and the others are now being home quarantined. Are we getting 300 beds every day? Are we creating that kind of infrastructure? I mean, people are just taking ready buildings and converting them into COVID centers. People are you just give them a bed and you tell them stay here. Where is the medical backup? There is nothing. There is a shortage of staff. There is a shortage of doctors. The poor municipal doctors who are handling the major brunt of this are not equipped and trained with the best in the field, because medical has become a privatized business. You know, the best brains have moved to the private sector. What is, I mean, believe me, when you have a look at a government hospital, the toilet, the facilities, you say, I'd prefer dying at home than being admitted there. And were we waiting for a COVID-like pandemic to get our act together as citizens of Bombay, which generates the maximum money for this country from time immemorial? This is the condition of our medical facilities. And then also look at the way we've allowed Bombay to, get these clusters. Today, it's easy to sit and say, oh, Dharavi is a cluster, X is a cluster, Nehru Nagar is a cluster. But this same Vikas Aghadi, the 3 people here, the Shiv Sena who was ruling the BMC from decades. So they cannot say we are new to state politics. You've been ruling this BMC from time immemorial. And the state has been run by NCP and Congress over time. Why did you even allow these clusters to happen? Why are you waking up now when there is a pandemic?
True.
I mean, it takes me, the average speed at which my car drives for work is 5 kilometers an hour. How much of time is wasted? Productivity is killed in this city. Forget the pandemic. We need to overhaul everything. Okay, right now we're talking of the pandemic. According to me, let me come back to the point. Bombay in particular, Maharashtra as a whole, cannot afford an easing of the lockdown. I understand the economic ramifications and all that, but I am sorry, we had the time. We couldn't get our acts together. There are cities like Goa which now have only 100
Yes.
or 200 cases. We don't, and it's spiking. It's going haywire. I'm the secretary of my building, and I have 150 flats in my tower. My son was stuck in the US, and he just came back 20 days ago through one of the evacuation flights. But I'm telling you that if you are an average citizen and you don't have an influence and a phone call to make here and there to a hospital or here and there in the BMC, you are in trouble, buddy. You are in trouble. Bombay does
Absolutely.
not.
Not just Akashdeep. See, no. I tell you what, sir. Frankly, it's not just that. If the chief minister acknowledging, the chief minister's office acknowledging certain cases of COVID-19 in Mumbai, saying we will help you out, and they did not find beds in hospitals, then they had to use all the influences within the medical fraternity to get one bed.
Yes.
And this too in a specialty hospital where they're ready to pay through their nose for whatever care is required. And that is another story altogether. But where I'm coming, Sanjay, you please realize when I'm saying what I'm saying, when I'm asking a Dr. Rajesh Parekh or an Akashdeep or a Sanjay Jha or a Rajiv Pandit, this is what I'm asking, sir. The 75 days of the lockdown was for Mumbai to be prepared for the unlock and for the burgeoning rise in cases, sharp rise in cases when the unlock happens, because it is natural it would have happened.
Yes.
Sure.
Where is that preparedness, Sanjay Jha?
Anand, I think both Dr. Parekh and Mr. Akashdeep, I think, have been extremely candid. They have put all the facts without, I think, mincing words on the table. I don't think any one of us can dispute what they have said, whether it's an economic argument, whether it's about political responsibility, or whether it's a sheer collapse of the public health infrastructure in our city. I would like to make one point here. I agree that the Indian average of around less than 3% fertility rate may make a lot of people feel very reassured. But ask the people whose families have been devastated, who have been in the 3%. I mean, imagine the kind of excruciating pain they are going through. And 3% in a country with such a large population size is still in absolute terms a very, very big number. So I think I agree with you. Dr. Parekh and I think Akashdeep have made, I think, the observations that should dictate.
But there has to be some account. I know it is. You're agreeing with
yeah.
me, but Sanjay, I'm just saying the Congress Party, the NCP. I'm just bringing in Rajiv Pandey. BMC. Rajiv Pandey has not yet spoken. Now, you please let me just bring in Rajiv Pandey and Akashdeep and Dr. Parekh. I'll come back to you, sir. He's not spoken yet. 20 minutes into the debate. Rajiv Pandey, please tell me, is this the result because Mumbai never followed the lockdown?
No, Anand. First of all, I would like to congratulate you that at the beginning you have shown certain good things, which is positive things, that how we are fighting. But as far as Mumbai is concerned, when the lockdown was announced, I can tell you that in 30% area there was no lockdown. Then there was a list of containment zone where people did not adhere the lockdown norms, and government did not take action. That is my first point. Second point, right now Shiv Sena government and Congress party and NCP, they are saying we will unlock the Mumbai. There are 735 containment zones. More than 20% people are living in those containment zones. So what to do with that? If you are opening a suburban train, what will happen? What Mumbai will face if 2 crore people, even 1%, it comes to 2 lakhs bed where we stand today. And I tell you one thing, as Akashdeep ji has rightly said, that the government 15 years were continuously NCP Congress. What did you do? In BMC, Shiv Sena is there since 1985. Right now, all 3 parties are together. There is no dispute in BMC and state government because both the place, same people are ruling. Sanjay Jha ji has talked very beautiful things, but tomorrow we have to face this. We have to ask, I asked Sanjay Jha ji, what is the plan, how to face this? It's not about, yes, I agree, and I agree with that, everything. Whatever Parekh ji has said, whatever Akashdeep ji has said. But the problem is, in Mumbai, if there is no activity, if we are unable to control COVID in Mumbai, it is going to affect a whole nation, because Mumbai is the financial capital of India. The main issue is just talking that we all are together, and there is no Congress BJP dispute in that. But the situation in Mumbai is so pathetic, Anand, you cannot even imagine. As Akashdeep ji has said, even we also suffer when somebody is calling and telling that please help us, and we are unable to help. I am telling you very frankly.
See, there are two very important points that we've missed out. A, when we say that Bombay and Maharashtra is at par with Tamil Nadu and Delhi, please get your facts checked. Maharashtra is almost 3 times more. And second most important point to remember is we are doing limited testing. I don't think Bombay is testing more than 10 to 15,000 cases a day. If you start doing factual testing like it's happening in the US, you are all just going to run away from the media, the people in power. I'm not putting the blame on you. The government has not brought corona to this state. But the government has brought the state on its knees because over years and years and years, we have not got our acts together. Now there's going to be rains. Now they are going to see dengue. You're going to see different kinds of flu. People are going to feel they've got COVID. They're going to run to hospitals. There's going to be a chaos. Why do we still not have tests? In our neighboring buildings, when a patient was found to have COVID, his other family members wanted to be tested. They were clearly told, sorry, we don't have tests. Just stay indoors. After 2 months, after crores of rupees coming, and of course, you have to generate that kind of money as a government to help in this pandemic, we are still being told that we don't have kits, we can't do enough tests, and at this minuscule level,
you see the reality
such alarming figures. Now, this is scaring me, Sanjay. I don't want to point fingers. Not at this time.
But there's something should have been done, no? Because there are all there.
Yes,
see,
yes, and
it's not about blaming. It's about what I'm trying to say, Akashdeep. My point is, why am I saying let's relock Mumbai? Relock it for 3 weeks, and in those 3 weeks, do what we didn't do in the last 75 days. Prepare, set matters right, put protocols, processes in place, get beds ready. Do it on a war footing.
Because it's going to get worse.
Yes,
because it's going to get worse. Because it's going to get worse.
It's going to get worse. Monsoon is going to further fuel COVID-19 along with other illnesses. Yes, Sanjay.
Anand, very succinctly, let me tell you this. Let me assure the viewers who are watching your program, and I'm glad that this is, a very well, kind of a program with a lot of content in it, that the government is considering all options. Now, we want a robust fight back. We do realize there are certain inadequacies. We do also recognize that, we are subject to, at the moment, how the public responds. You need a lot of active citizen participation in social distancing. And all these options are on the table. So, let nobody believe that the government is not going to be responsive to the challenge. I'm just pained. I just want to tell you this very honestly. I'm very pained that my dear friend Rajiv tried to score political points here. I need to tell him that if you accuse the Shiv Sena of running the BMC for the last 25 years and doing a dismal job, it's the BJP which has been a partner of the Shiv Sena for the last 25 years. So you are terribly guilty, and please let's not try and make this debate pedestrian and puerile by scoring points.
We need yours.
Can I just finish? Sir, my point, Sanjay Jha, I have limited time. Let's not fight with each other. Sir, everybody has made their points. Sanjay, I have limited time.
No,
Okay, let Sanjay complete. I'm going to extend the debate by 3 minutes. Let Sanjay finish his point. 3 minutes.
I'm making
3 more minutes on the debate, please. And I'll go to Dr. Parekh. We started the debate with him, we'll end with him.
For God's sake, let us look at this while we are doing it today, city specific, and it's a very appropriate discussion because Mumbai is a hotspot of a very significant and alarming nature. Please look at this as a national crisis at the moment.
Sir, we do not have crematoriums to bury 100 bodies a day.
Sanjay,
we do not have crematoriums in Mumbai. My point is, sir, this should have all been done on a war footing in the last 70 days in Mumbai. with a
what has happened?
municipality which has got reserves of 60,000 crore rupees, reserves of 60,000 crore, has got a budget of 25,000 crore, and it has got perhaps the wealthiest who would have come forward to contribute, and people would have come forward to contribute. Secondly, Dr. Parekh, as I come across you, social distancing was not imposed. The law did not raise the stick to those who did not bite the carrot. The law did not tell the Mumbaikar, if you don't stay indoors, you are going to face it. They did not impose it strictly because 30 to 40% of Mumbai never respected the lockdown, and we are facing the cost. And so the last 5 days, Dr. Parekh, what we have seen, Dr. Parekh.
Right now, we need to be proactive.
We needed to be proactive.
Reactive.
Last 5 days, what we have seen in Mumbai, sir, Dr. Parekh, look at how Marine Drive turned up. People living in South Mumbai, look how they turned up in Marine Drive. That itself shows where the responsibility is gone for a toss. So if people who are educated, learned, who know what it implies cannot do it, how are we expecting people who are frustrated because of their livelihood to even follow social distancing in Dharavi, where they have to live at 46 degrees centigrade under those asbestos ka chhat? Because it's impossible to live inside those houses, those places, those slums. Dr. Parekh, I'm saying we are standing at a situation where unless we correct it, we don't lock up Mumbai, and we don't get onto it on a war footing as if we are preparing for a war. Mumbai didn't prepare for a war, sir, and that's why we are on a losing ground there.
How much time do I have? War. I know you're running out of time. How much time do I have to answer this?
Well, sorry, Dr. Parekh, we've got news just coming through. I have to cut short the debate. We'll take this forward. We'll take this forward into next week. I apologize because we've just got news coming in. Prime Minister is going